Nasal tip projection. Projection of the nasal tip can easily be assessed by different methods. Ideal nasal projection on the lateral view. About 50 to 60% of the tip should lie anterior to a vertical line drawn adjacent to the most projecting part of the upper lip and can also be measured as 0.67 times the ideal nasal length. One of the most common methods of assessing nasal tip projection is the good method. Nasal length is measured using a line drawn from the nasion, N, to the nasal tip, T. A second line is drawn from the nasion, N, to the alar crease, AC. Nasal projection is then measured using a perpendicular line from NAC that passes through the nasal tip. This effectively measures the nasal projection from the posteriormost feature of the nose, the alar crease. In Good's method, the ideal ratio between nasal projection and nasal length is 0.55 to 0.61. Powell and Humphrey's method. Nasal height is measured from nasion, N, to subnasal, SN. Tip projection is measured using a perpendicular line from NSN that passes through THE nasal tip. The ideal ratio between nasal height and tip projection is 2.81. Simon's method. Basal length is measured from subnasal, SN, to the nasal tip, T. Upper lip height is measured from subnasal, SN, to vermilion border, V. The basal length and upper lip height should be approximately equal. Crumley and Lancer method. Nasal length is measured from nasion, N, to tip, T. A second line is drawn from the nasion, N, to the alar crease, AC. Nasal projection is measured using a perpendicular line from NAC that passes through the nasal tip, T. The right-angle triangle formed by the above three lines should ideally have a 3 to 4 to 5 ratio. Tip columella lip complex. The degree of tip rotation is determined by the degree of the nasolabial angle, angle of rotation, which is not the same as the columellar labial angle. The nasolabial angle is measured by drawing a straight line through the most anterior and posterior points of the nostrils as seen on the lateral view. The angle this line forms with a perpendicular line to the natural horizontal facial plane is the nasolabial angle. I prefer a 95 to 110 degrees nasolabial angle in women and approximately 90 to 95 degrees in men. Nasal tip rotation is defined as movement of the nasal tip along an arc with constant distance from the facial plane. A ptotic nasal tip may be otherwise described as underrotated. Thus, the terms ptotic and underrotated as applied to the nasal tip are used interchangeably. The degree of tip rotation is assessed by evaluating the nasolabial angle. The nasolabial angle may be divided into two component angles by drawing a true horizontal line intersecting through the subnasal when the patient is in natural head position, upper component, UC, which represents the nasal columellar angle and thereby nasal tip elevation, and a lower component, LC, which represents upper lip inclination. Variations in the upper component of the nasolabial angle would suggest a change in nasal tip elevation. Variations in the lower component of the nasolabial angle suggest a change in upper lip inclination. Better understanding of the changes to the upper and lower components of the nasolabial angle would aid in surgical treatment planning. Allerobular complex. The columella should extend 3 to 5 mm below the nares. The lateral relationship between ala and lobule is approximately 1:1. A slight overgrowth of the lobule is aesthetically acceptable, whereas that of the alar part is not. Columellar lobular angle. The nasolabial angle is often confused with the columellar lobular angle, which is formed at the junction of the columella with the infratip lobule. This angle is normally 30 degrees to 45 degrees. A prominent caudal septum can cause increased fullness in this area, which can give the illusion of increased rotation, despite a normal nasolabial angle. Degree of double break. The double break signifies the junction of the medial and intermediate crus. The double break begins when the cartilages begin to curve laterally towards the dome segment. An exaggerated double break will lead to the appearance of a short nose. The absence of a double break will add length to the nose. Therefore, the double break and its degree will affect the appearance of the length of the nose. The dorsum is analyzed by drawing a line from the radix to the tip defining points. In women, the ideal aesthetic nasal dorsum should lie approximately 2 mm behind and parallel to this line, but in men, it should approach this line to avoid feminizing the nose. The lip-chin relationship. The ideal lower lip position is 2 mm behind a vertical line dropped from a point half the ideal nasal length along the natural horizontal facial plane. R. Radix. T. Tip. S. Stomian. M. Menton. The nasal length, radix to tip, should be equivalent to the stomian to menton distance, as described by Bird and Hobar. Nasomental line. The nasomental line connects the nasal tip to the lips and then the chin. The chin should deviate no more than 4 mm either side of the nasomental line to be considered attractive. Basal view of the nose. 1. Columellar base. 2. Central columellar pillar. 3. Infralobular triangle. 4. Soft triangle. 5. Lateral wall. 6. Alar base. 7. Nostril sill. The nasal base can be divided into the tip lobule and base or pedestal. The base consists of the medial crura as they meet the posterior septal angle. Assessing the nasal base includes an analysis of the undersurface of the nasal tip, the alar rims, and the columella. The ideal shape of the nasal base should generally fall within the shape of a soft triangle when viewed proximally, with the nostrils comprising 2/3 of the height. The dome angle is the angle created between the medial/intermediate crura and the lateral crura. Note the normal divergence between the intermediate crura that is responsible for the columellar lobular angle or double break. The columella can be divided into 3 equal segments: the anterior lobular, a narrower intermediate and a wider basal segment. The base view resembles an isosceles triangle, with the length of the columella being twice the height of the lobule and equal in length to the height of the upper lip. The width of the alar base is measured from one alar crease to the other and should ideally be equal to the intercanthal distance, especially on Caucasians. In contrast, the alar flare is the maximum degree of alar convexity above the alar crease, which ideally should not extend more than 2 mm outside the crease. The dome angle, which is evaluated on a basal view, evaluates the angle of divergence from a different perspective. This measurement is approximately 25 to 40 degrees. The caudal flare angle, which compares the width of the dome from cephalic to caudal border, should be 25 to 30 degrees. The optimal divergence, angle of dome divergence, of the two domes lies in the 50 to 70 degree range when viewed from above. The physical separation of the caudal domes should be somewhere in the 4 to 6 mm range. This allows for a relative shortening of the cephalic edge from attachment point to center, when compared to the caudal edge, which should be longer. The distance between the footplates ranges from 7.5 to 15 mm, the average being 11.4 mm. Should the patient exhibit an overprojected tip, the result will be a divergent footplate. The columella is a relatively complex anatomical structure that is located in the nasal base between the nostrils. It is made of crura, muscle, skin, and soft tissue and does not only provide support to the nose but it is also an aesthetic component of great importance. At the base of the columella the footplates protrude laterally, giving amplitude to then adapt at the level of the medial crura. Deformities of the lower lateral cartilages lead to untoward aesthetics and functionality of the nostril and columella. The ideal nostril possesses a teardrop shape with a long axis extending from the base to the apex. There is slight medial tilt of the long axis toward the midline. When viewing the nose from the base should create an equilateral triangle. The nostrils can present in various sizes and shapes but generally are oval triangular. The ratios of both columella and lobule to base width will affect the axis of inclination. When drawing lines through the long axis of each nostril, they will intersect in the mid-portion of the lobule Cusalina con Bigeri, CKB, point. If the CKB point is caudal to the lobule, it can indicate a wide base or an underprojected nose. By contrast, if the CKB point is cephalad to the lobule, it can indicate a narrow base and an overprojected nose. From a base view, the ratio of the columella footplate complex to lobule should be 2:1. The columella footplate complex should also be analyzed for the length of the columella and amount of lateral flaring of the foot plates. Foot plates that flare laterally from the mid-columella can create a wide base and small nostrils. Aller-columellar relationship, ACR. According to Gunter, aller-columellar disproportions can be quantified by drawing a line through the long axis of the nostril and a second, perpendicular line drawn from the alar rim to the columellar rim that bisects this axis. In normal ratio, the distance from the alar rim, point A, to the long axis line, point B, should equal the distance between the long axis line and the columellar rim, point C. AB equals BC is almost equal to 2 mm. Increased distance for the cephalic nostril half, greater than 2 mm, indicates the alar retraction, while increased distance for the caudal nostril half distance, greater than 2 mm, indicates hanging columella. In converse, decreased cephalic half implies hanging ala, while decreased caudal nostril half can be an indication of retracted columella. If abnormal, the deformity can be stratified into 6 classes. Classes I to 3 describe increased columellar show. Classes 4 to 6 demonstrate decreased columellar show. The final critical part of the preoperative analysis is the intranasal exam. Deformities or abnormalities of the septum, turbinates, and internal nasal valve are evaluated. If turbinate hypertrophy is identified, the underlying etiology should be investigated and a detailed history taken, as the enlargement may be either congenital or acquired. In nasal aesthetics, the nasal index consists of the ratio of the breadth of the nose to the length of the nose. This ratio varies widely between different ethnic groups per the climates associated with their geographical locations. For example, broader noses are favored in warm climates whereas narrower noses are favored in cold climates. Hall 1995, Risley 1915, Williams 1995. The nasal index, NI, the ratio of nasal width to the nasal height multiplied by 100 is useful in sex determination, distinguishing racial and ethnic differences, nasal analysis, and rhinoplasty. Nasal index is calculated by nasal width divided by nasal height multiplied by 100. Depending on the nasal index, there are different types of noses. Dorsal nasal height refers to the overall height or projection of the dorsum from the face when viewing from a profile view. Dorsal height is measured at 3 points, namely the nasion. The distance or height at the nasion is measured from the anterior corneal plane, and is ideally between 9 and 14 mm. Rhinien, At the Rhinion it is measured from a vertical line from the alar sulcus, perpendicular to Frankfurt horizontal. It ideally measures between 18 and 22 mm. And tip defining points. The ideal dorsal height at the nasal tip is between 28 and 32 mm. Simply, we can use the 10-20-30 mm rule corresponding to nasion, Rhinion, and nasal tip heights, respectively. The radix is defined as an area whose center is at the nasion and defines the nasal root or takeoff area. Inferiorly it extends down to the level of a horizontal line passing through the lateral canthi. Cephalad it runs an equal distance, ideally to the level of the supratarsal crease. The ideal height of the radix is between 9 and 14 mm measured from the anterior corneal plane. Key features of male noses, compared with female noses. Dorsum tends to be straighter and wider with decreased concavity at the superciliary ridges. Nasal dorsal profile, a line drawn from the radix to the tip defining points, should approach 1 mm or less, instead of falling 2 mm behind and parallel to this line in women. No supratip break. Tip rotation slightly less, 95 to 100 degrees versus 103 to 105 degrees in females, because less nostril show secondary to a longer nasal dorsum. Stronger chin abutting the plumb line drawn tangential to the upper lip, versus 2 to 3 mm posterior to this line in women. Broader, more bulbous, nasal tip, in general. Skin is usually thicker, masking the amount of change that can be perceived.